Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face to Facts, we're going to be focusing all about the lips and what you should do if you want to have more lip show. Now, there are a variety of different techniques that are available to you, and we're going to kind of just go over the differences between all of them and when you might consider one versus the other, or if you want to do a combination of them. So number one, the easiest thing to do is what's called a lip flip. This involves using neurotoxin, such as Botox, Dysport, etc., to selectively paralyze the muscle that lives up here that curls in the lip. So you will notice, maybe in me, or if you look at other people, that sometimes when they talk and when they smile, like this really hard, it seems like they lose some of that red lip show. And so what the neurotoxin will do is block that from happening so that at rest you just have more red lip show. Unfortunately though, it is not permanent and it does wear off after, a few months, and it also does not work right away. The second option is to do lip filler, and lip filler involves using a jelly-like substance to inject jelly into your lips, and what that does is it makes your lips pop out a little bit more and maybe give you a little bit more volume. The benefits of this is that you pretty much get the results right away, and it should last you for a good several months, even up to a year or longer, depending on how fast your body breaks it down. So you can see that that benefit is definitely going to be much more than what you would get from a lip flip. The last option is a surgical option, and this is a lip lift. Now, this is a little bit more involved than the other two just because it does involve a knife, which I get is a little bit scary, and it does involve stitches, which I also get is a little bit scary, but it's still relatively considered a smaller procedure, and that this is something that can even be done with you completely awake, or you can be asleep, up to you. And the benefit of doing this is that we basically will sacrifice some of this white lip height to give you more red lip show. The times when I strongly recommend that you think about doing a lip lift surgery over doing any of the other two is when you have a really tall philtral height. That's this location right here. So if that's really tall, and especially if you find that it's taller than here or about the same height as your lower lip chin area, then that might be the time to consider a lip lift. Another thing too is if you don't see a lot of your upper teeth when you are either smiling or at rest. So I'm gonna just pause. If I just let my mouth hang open at rest, you can see a little bit of my upper teeth. That's normal and kind of a youthful appearance. But as we age, this stuff starts to come down and you see less and less of that. If you are someone who has a tall philtrum and or very little dental show, lip filler is only going to further pull that down and drag it down and make that problem even worse. So it's not even going to help you get what you want anymore, and if anything, it might actually age you, which is not what people want. So my recommendation is if you want to build up your lip and show more lip, that you go to someone who's an expert who can do all three of them, or knows when you should do one versus the other, and then that way you can make sure you are getting the right treatment for what you want. That's today's episode of Face the Facts, all about lips and how to get more lip show, and we will see you guys next week.